Hello viewers, welcome to this week's episode on Healthwatch on Advent Cable Network Nigeria ACNN. I am Angela Emeka Ivibo. At the last episode, we began a discussion on the Nigerians 2023 election with the health sector in view. We considered the critical areas the new government should be considering if they win the next election, which is about 28 days from today. The picture on your screen is a typical representation of the situation in some of the hospitals in Nigeria. This is a very painful sight. Apart from perhaps a few private hospitals, the majority of hospitals in Nigeria are no more than mere centers, lacking in almost everything. Some have described Nigeria's hospitals, perhaps too harshly, as where people go to die. Presently, the global average life expectancy is 73 years, but Nigeria's average life expectancy, according to the World Health Organization, WHO, is 55 years, putting us at the fourth country with the lowest life expectancies in the world. So the average Nigerian will be lucky to attain the age of 60. In the last 10 years alone, Nigeria has added almost 50 million people to its population without commensurate increase in investment in health. In less than a month from today, Nigeria will be electing a new commander-in-chief to pilot its affairs for the next 4 years. Although there are over 20 presidential candidates seeking the same office, there are 4 major presidential candidates, and they are Mr. Peter Obi for the Labour Party, Asiwaju Bola Ahmed Tinubu for the All Progressive Congress (APC), Alhaji Atiku Abubakar for the People's Democratic Party (PDP), and Dr. Musa Kwankwaso of the New Nigerian People's Party (NNPP). Well, as it concerns us here on Healthwatch, and in continuation of our previous episode, we will be discussing the 2023 election with the public health sector in view. What areas of the public health sector should the new leadership tackle headlong as a matter of urgency? What kind of questions should we be asking our leaders as they make election promises? My guest on the program today is Chukwuebuka Ejekam. He's a public health expert and is also a presenter of the Bible study on this same network, ACNN. You're welcome to the program, sir. It's good to have you. Today, you're not a presenter, you are a guest, my guest. It's good to have you.
Thank you.
Thank you for coming.
Thank you for
coming.
Work.
Thank you. Yeah. So we started this discussion in last episode. We're talking about the election.
Yeah.
What is in every mouth or mind of every Nigerian is the election.
Yeah.
What are we expecting? What do we want? But before we start talking about the elections, I want to get clarity on the public health and then I think the health services. What's the difference? Because I know there's a difference in what the activities of the both areas of medicine are saying.
Okay, yeah. Thank you very much. But just because you started off saying we're in the heat, at the climax of electioneering and preparation,
which is less than 28 days from today.
I'd like to also lend my voice to cancel that. I hope we do all have our PVCs.
Yes.
It's important. That's our power to decide.
So everybody should have their PVCs.
Yeah, if we're actually looking for better health in terms of measurable health outcomes, good health, we can decide that also with our PVC by getting in people who take health perhaps as a first line charge, prioritize it. So that's by the way. Now to the issue of public health. And what I'll say, you call it health services, but maybe clinical medicine. The major difference is public health deals with population health. It deals with health on the population level. Clinically, individuals go to consult their doctors, maybe when you are having some signs, your routine checkups. But public health is looking at health from a population perspective. What do we need to do to safeguard, for example, Abuja as a city so that we don't come down with an epidemic?
Just like the last one we had, the COVID.
When we had the COVID-19. Are there things we would have done? Because in epidemiology, we'll begin to talk about person, place, and time. The first index case of COVID, could we have prevented it from migrating out of China? So that the transmission doesn't. Public health look at issues at that level because your interest is on the population. even though it is a accumulation of individuals that builds up to give you that big population, but you're looking at population perspective. But clinical medicine deals with health services in the hospitals, health services to individuals, hinging on the pillars that makes for effective health system strengthening. But when it comes to public health, you're looking at population medicine. In fact, before we started calling it population medicine, there are places that it was called community health. There's a man called John Snow. Good students of epidemiology will remember him. The cholera outbreak in the UK, in London, where he was able to use spot maps to locate the spots where the outbreak began, and they were able to contain it. What our environmental health officers do is public health. There are various dimensions of public health. What I do every day, I'm into public health research. So we gather data from communities in order to inform health priorities, so that policymakers can take decisions based on evidence and not based on some wishy-washy kind of thoughts. So clinical medicine is dealing with individual health. Anybody can go to hospital and do it. But public health is looking at epidemics at population level. How do we manage it? Who is getting infected? At what time is the person getting, and at what place? What are the preventive things we need to do in order to be able to contain health? There are 3 levels of prevention in public health. We look at the primary prevention, secondary, and tertiary. But those are maybe detailed discussions for other day. But just for a non-initiated person, public health deals with health at the population level, not on a unit individual level.
So which is very important, because
we're getting into Nigeria as a population now.
Exactly. So what we're doing now has to do with the population.
What will be our health priorities going into the next
in fact, that's just a perfect lead into my next question and line of thoughts, because we have an election coming forth. In as much as there's the individual part, but before you say something is okay, a majority of the population should have been considered before you say this particular thing is okay. And somebody needs to tell us that, this money we've put in here, or this particular effort we've put in here, has done this for us. So now elections are coming. And I know the public health experts are very much involved in policy making, very much, because they have the data and have the information. What should we be doing? Or let me start with the new commander-in-chief that's coming in, whoever the person is. We really have who we hope for will come in, but we're looking at what should this person be looking at as regards to the health sector, because very important. Now, people are talking about security, but more people are losing their lives to health than even, no matter how much Boko Haram we're fighting, more people are losing their lives to health every day. At least somebody would have died in a few minutes,
even
as we're discussing on some health-related matter. So what should the new commander-in-chief be looking at in terms of the public health?
I think the ultimate end of health in every society should be the preservation of health and well-being. That's why we discuss health, and it's important not just to us as human beings or individuals, but also it's also important to God.
Yes, of course.
One of several instances in the scripture, Jesus went about doing good, healing all manner. And Isaiah 33:24 tells us that no resident of Zion will say, I am sick, because it's something at the very heart of God. Now, for us as human beings and on this side of eternity, Nigerians, it's also a priority to us. The question is, what should be our focus? There are thresholds. When a particular disease reaches a certain threshold, you begin to say this disease is of public health importance. Peradventure, a certain proportion of a population is beginning to come down with a particular health outcome. Then you begin to say we need to pay close attention. For example, though that's not where I'm going, mental health is becoming an issue because thresholds are rising, increase in suicides. We are seeing people whose adversity quotients are low and they can manage the pressures of living in today's Nigeria. For me, in terms of expectation from those who will be coming on board in the new dispensation, be they at the executive level, legislative level, or perhaps judiciary, because all these arms of government, they've got parts to play in ensuring.
Even State House of Assemblies.
Yes, whether at the federal or state level, they've got parts to play in ensuring quality health for Nigerians. I wouldn't want to kind of reinvent the wheel. I wouldn't be saying things that are perhaps entirely new to us, except to the uninitiated. Generally, there are existing frameworks, health-wise, that if we are serious and implement the content thereof, at least for a larger proportion of Nigerians, they will have better health experiences in the years ahead. We have the National Health Act.
Okay.
And even let's talk about legislators even. You know, in the Senate and the House of Rep, they have committees on health.
Okay.
If they only just do their work, exercising oversight over the MDAs, those health parastatals, health departments, agencies of government that are trusted with the responsibility of ensuring quality health for Nigerians, if they just do it, if they just do their work, I think we gain some mileage. But let's speak of some specifics in terms of frameworks that exist. The government of the former President Goodluck Jonathan, I think on the 31st of October 2014, signed the National Health Act. If you read that document, quite beautiful. Section 11 talks about the Basic Healthcare Provision Fund. That fund is supposed to take care of health insurance for Nigerians. That fund is also to make for essential provisions for the primary health care facilities across the 774 LGAs in the country, providing them with essential supplies, managing their logistics, and ensuring that they don't run out of vaccine, especially immunization coverage for children under 5, all those ones. That fund is also to ensure human resource for health in terms of the midwives, the CHUs, and even the medical officers. So the primary health care system should be strengthened, and our new set of leaders should ensure, based on the provision of the Basic Healthcare Provision Fund, that Nigerians at the community level access quality and affordable health. The contents are already therein. So but who is ensuring that we are living out the creed as espoused in the document?
Who is it? The senators that are supposed to ensure the implementation? Is it the president? Is it the who? Because the document is there. What you're saying now is really beautiful. You know what to do. But really, human beings, if you put laws and you don't ensure so who is supposed to be responsible? All of us are looking at the commander-in-chief now, want to vote the president. He needs to work with a team to get his job done. It cuts
across, and the roles are delineated, even in the document, so to say. But for oversight, the executive is meant to implement.
Okay.
They are handling, and when I mean the executive, is not restricted to the C&C alone. Governors are executives at the state level.
At their state levels,
local government chairman are executives. Even CMDs of specialist hospitals or like national hospitals, CMD, tertiary institutions, the CMDs, the secondary health facilities, the state government hospitals at the state level. Those who are managing them, they are executives at that level. They can implement. When they don't, the people at the other arm of government, via oversight, should ensure that the things are done. Because ultimately, it's Nigerians that are dying. It ultimately is our people that are being affected. Look at our maternal mortality ratio. Look at our life expectancy as a nation. Even some nations not as endowed as we are, faring better than us. Imagine a country like Niger Republic having a higher life expectancy. I think Nigeria is ranking, either 167 on the global index. And this is a country that is hugely endowed. Look at the best of surgeons in the US. If you take a sample, you know that Nigerians are among the best. But they're not here. They're over there. Why would we have a doctor to 10,000 patients, national average, with geopolitical differentials across the zone? In the south, you may have a doctor to 30,000. In the north, it's as bad as having a doctor to 45,000.
Wow.
Why would we be having such? So somebody is meant to make sure that we have adequate racial representation. Make sure that in the facilities that we have the full complement of health personnel to be able to attend to individuals who are coming to access quality health care. Talk about the national health insurance. Well, it used to be national health insurance, but by May, I think it was 19th of May 2022, graciously the current president, His Excellency Muhammadu Buhari, signed into act, and it became the National Health Insurance Authority. With a full legal
But the name make any difference? Does it mean that the authority now is enforced?
They have a mandate.
All right, okay.
They have a mandate. One, to ensure that all Nigerians are covered via health insurance. And it's beautiful to note, not just all Nigerians, all legal residents in Nigeria are covered via health insurance. They also have a mandate to ensure that private sector participates in the provision of health insurance for Nigerians. But since Obasanjo started that body, 2005, I'm not sure we've gained 50% coverage. And the coverage is the only people in the formal sector.
Yeah.
What about people in the informal sector? Don't the vulcanizer, by the way, need health? Don't the wheelbarrow pusher in the hospital, doesn't his wife get pregnant? Wouldn't he need to access maternal services, antenatal care services in the hospital? Who covers? Largely, Nigerians are still doing out of pocket expenditure for health.
Now, with the Health Insurance Authority, is it the government or is it the people do not know? Or because so
it's multifaceted.
Okay.
The awareness perhaps is low. And there should be a department within that is reposed with the responsibility of health promotion and education. I mean, when we were back in the days when we studied public health, there are people who majored in health promotion and education. There are community health officers that goes to create awareness, perhaps on a particular health issue. For example, when they want to talk about prevention for a particular health outcome, they go to the communities and sensitize people. Now, if this thing is existing, health insurance, if it's existing, who are the people who are supposed to go and conscientize and create awareness amongst the population to begin to assess it? Many people are not assessing it. Many people are not on board.
Some people don't even know what.
Some people don't even know. People in the informal sector.
Yes,
and these are in line with the provisions, even at the global level, universal health coverage, UHC. Nobody should be stressed assessing health. I mean, for crying out loud, health is not a privilege. That if you're a governor, you're building health facilities, you're sending human resources. I mean, you're not doing us
a favor. It's actually the right.
Something extraordinary. It's every citizen's right to have quality health. It's actually our right, based on the provisions of the universal health coverage, based on the commitment that nations have made, even in the Sustainable Development Goals. If you look at those goals, those 17 beautiful goals, I can bet you that 3, 4, 5, up to 6 of them, directly or indirectly, connects to health. And so it's every citizen's right to have quality health. So those whom we are bringing on board in the new dispensation should be careful to ensure that Nigerians have access to quality and affordable health. Legislators should just do their job. Oversight the ministries, oversight the agencies of government, the parastatals of government under health to fulfill their mandate, their core mandate. Nigerians should not be dying of fake drugs. The legislators should ensure that NAFDAC oversight drugs that are coming into this country, as well as those that are produced in the country, to make sure that they meet the minimum standard, that they've passed through the stages of clinical trials and they are good enough for people to consume. These are the oversight function, but sometimes it's unfortunate. I mean, Nigerians, sometimes we go there, we don't do these things. Perhaps we accept kickbacks, and the next person dies on the road. Even RTA, let me even talk about RTA, because health, there are so many things that guarantees quality health.
RTA will be
road traffic accidents.
Okay, road traffic accident, yeah.
It's a health issue. People are dying on the road every day. It's people we are losing. These are people that would have contributed ordinarily to our GDP if they are to be alive. And we are losing them via road traffic accidents. It's a major issue. When you look at the numbers, because from a public health perspective, we consider such numbers. We move by numbers. When you look at the numbers that maybe Federal Road Safety rails out on a daily basis, how many Nigerians we've lost via accident? These are husbands of people. These are wives of people that would have contributed to building our GDP if they were to be alive. So, Who is the person who oversights the Ministry of Work to ensure that when a road contract is given, because you may think it doesn't concern health, it does. When a road contract is given, Nigerians have access to quality, good roads so that they don't end up cutting short their life prematurely. So these are things that the next crop of leaders that will come on board have to pay close attention to, so that we don't unnecessarily. And again, there's a dimension that just crossed my mind now. In the 2023 fiscal budget, the allocation, graciously, this is the best we've had in recent history. We have over 1-point-something trillion allocated to health.
Yes.
Allocated to health. I mean, this is the best we've done as a country. Though somebody will argue that it's still not enough, but at least from recent history. Now, when you begin to disaggregate the specific sectoral appropriations based on that budget, there are some of them that will go into capital expenditure, recurrent expenditure. There are some that will even go to vaccine procurement, aids and grants. The legislators that will come on board have to ensure that these monies that are appropriated, that will go to several MDAs of government, are utilized for the specific end they were appropriated for. If we do such, and then facilities are built, human resource for health are recruited, essential commodities are procured, vaccines for our children. Unfortunately, Nigerian children still die for vaccine preventable reasons. If we do such, I mean, we'll be taking the notch higher in terms of our population health, in terms of our public health issues going forward. So for me, I'll just say let people do
what
job.
they need to do.
I will not be relentless.
Now, with your experience and what we also see as Nigerians, you can't what you don't use, you wouldn't see the need to. If you're not in the public schools, you may not. If your child is in the public school, you may not see the need to
get
any working, because in your mind somewhere, every school is like the private school that you go to every day to pick your kids. But if you go there and your child said, "Daddy, today we couldn't learn because there was no light or the teacher couldn't come," you wake up and say, "Okay, something is happening here. Let's see what is happening." The same thing with the health sector. Doesn't it have this sheer no willpower to oversight? Doesn't it have anything to do with the fact that even the leaders don't use the facility or don't even use the country medical facilities available? Isn't that part of what our problem will be, especially with the new leaders coming? If the person is not using our facility, he doesn't have any business being our leader.
And for me, that's tragic. And also, very appalling that even people who campaigned in 2015 made promises that we won't be accessing healthcare outside of the shores of Nigeria. Unfortunately, we've watched some of them jet out. Even to treat as something as common as perhaps headache. It's unfortunate. We have a state health clinic. If I tell you the allocation that goes in the annual budget to the state health clinic, and then you see president and CNCs leaving the state health clinic and then jetting out, it's so unfortunate. And they are gunning.
And they're not jetting out free.
No.
It's not free.
Some of them in recent past will come and try to counter that argument that have we cared to know whether it's taxpayers' money that is funding those. That sometimes these people use their... But for me, that argument is dead on arrival.
It's dead on arrival, yes.
Because one, as a leader, you are supposed to lead by example. You are supposed to put confidence in the system. Let people have confidence in our health system. And that's why you are there as a leader. Ensure that health gains are optimized for your populace and not at the slightest thing jetting out. And it's tragic. And that for me is not just health, education-wise, education sector, all across our sectors. We seem to have this fancy for whatever is not made in Nigeria. The clothes we wear. And so there needs a need for massive reorientation for us to believe more. We have the best of doctors. Via the message of God, there have been times that I've been outside the shores of this country and I've interacted with professionals who are Nigerians. And they will even be referenced by their colleagues who are not Nigerians, telling, oh, this person is good and he's a Nigerian. So why can't they stay back here? Sometimes we travel out and they also meet these Nigerians out, which if the systems were working here, they would have been here. So it's unfortunate that our leaders go out to assess health. Let them improve this system for the good of all of us. I mean, there are people who cannot jet out, and they are equally Nigerians.
They're equally Nigerians.
That you're occupying a position of privilege is not the reason why you should forget them. The tragedy is that if we don't do something, you know, I remember a wise one. I try exactly to remember the name, who once wrote a long poetic essay talking about they came for the Jews. I was disinterested because I'm not a Jew. They came for this group. I was not interested because I don't belong to that group. Until finally they came for me, and there was no one around who would be interested because they've taken off. I'm trying to picture that poem. I read it somewhere. Unfortunately, if we don't get interested in building public health, a time will come when there will be nobody here, and we can have emergency at any time. And between the time you will leave your house to get to the airport or even to fly out, you might not survive it if you don't improve the system here. I think one of the presidential candidates said something that touched me. I was watching one of his videos sometime, and he talked about what led him into building public wealth, where he attended a course and a man called him and told him, yes, you're doing well in your 40s, you're doing well, you're doing this, you're doing that. That's personal wealth. What will build a sustainable society for now and for tomorrow is when you build public wealth. And that was one of the inspirations that got him into public life. Our leaders should become interested in building this system, strengthening it. You may have the means to travel out. What of the people in your kindred, the people in the village? I've lost people. I've lost a woman in my village for something as small as delay between she was pregnant, labor came upon her, between the time she was able to get to where she will access health. Because the first place she went to at that time in the night, nobody was there. And by the time they moved her from this place to another place, we lost her. What if it happens to someone close to you and you're a legislator? You are the one who would have circumvented that from happening, but you didn't because you felt I can always jet out. What's going to be the end? So our people need to restore. I pray the next crop of leaders will restore confidence in our public health institutions, our hospitals. Go there. Build their capacity. Give them the equipment. The remuneration should be encouraging. I mean, health is an essential service. Those who are providing health should in themselves be healthy.
Be healthy.
Those who are providing health should in themselves be healthy. And not just being healthy physically, but what they get at the end of the day doing that work should be encouraging enough to keep them here. You know, health, when WHO defines health, they are not looking at health as just a state of physical well-being.
Yes.
Your spiritual health, your mental health, your welfare, your financial health is important also.
Yes.
Because when a man is hungry and angry, I don't know how his physical health, there is a connection. Those good students of biochemistry will tell you the interplay between how your nerves connect when you are happy, when you are not happy, and all those things. So our leaders should ensure that our public health institutions across all levels, but for me, especially at the community level, the villages, the hinterland, that they are strengthened. Imagine a local government chairman assessing health in a facility that is domiciled in his local government.
It will definitely
imagine
improve.
the statement he's making to people in that local government. Imagine a state governor who goes to the general hospital in his state to assess health, even if it's to check his BP and not to go outside there. Imagine the kind of confidence it will build into people. Imagine a president who stays. I can't remember the last time I was told that maybe the Queen of England or the Prime Minister of England traveled out of the UK
to get treatment,
to assess health. Even for an African country, South Africa here. I can't remember when last I heard that their president go out. Nigerians go to Egypt. Nigerians go to, but why can't we stay here and build our system?
Well, and on that note, we'll come back. We'll go on a quick break. But when we'll come back, I want us to talk on the primary health sector.
Yes.
You know, and what kind of questions? Young people are just praising everybody, but we need to begin to ask
questions.
Who are we asking, and how should we hold them responsible when the time comes? Even after they come into office, we should be holding them responsible for that.
Vigilance. We need to continuously be asking our leaders.
We'll be right back, viewers.
In terms of true worship, we must seek the Lord. We will not be able to come with all our perfections.
We will recognize as superseding every other gift. So love, in essence, is very important. Our position is who we are. Our disposition is the way we relate to who we are. So it's not about your position, it's also about your disposition.
People of God, I want to tell you that no matter who you are, no matter your position, your status,
you have encountered that superior power, the efficacious power of the blessing.
It says this God hears prayers, and then he expands the limits of whose prayer is heard.
Welcome back, viewers. Before we went on the break, we were discussing the 2023 election with the public health sector in view. And my guest is Chukwuebuka Ejekam. He's a public health expert. Thank you so much.
Thank you.
You know, the passion in talking about the issues in the health sector. You know, when you go to the hospital, you just go to the hospital and you get attended to. If you don't get attended to well, you get angry and you leave. But there are piles and layers of issues that are leading to you not being attended to properly.
Exactly.
So it's not just the doctor that is the problem, it's that there are layers of issues.
Yeah.
But now we want to talk about the primary health
Sorry,
care.
and that even explains why incessantly you hear that enemy has gone on strike. And these are issues that are built up over time.
So they're not
there are
just
layers.
going on strike
No,
because
no.
they don't want
It's
to do their
commonplace
job.
in the health and education sector, always going on strike. But if you begin to look deep down, you see layers of issues.
Layers of issues. One of the things we'll talk about, which is later after the primary health, we'll talk about the remuneration for the people in the health sector.
Yeah.
Because I know doctors and people in the health sectors are one of the best paid in the world. So that when you're at work, you're not thinking of something else. But let's look at the primary health care centers. Now, there are, I think, about 33,000 of them, if I remember right, scattered across the country. And not up to 30% of them are even functional. That's me praising, you know, pushing it up there, you know. First of all, who's responsible for equipping the primary health care centers?
Yeah. Based on what the law provides for, it is within the jurisdiction of the local government administration to manage the PHCs. But like you say, there are layers of issues. The local governments in themselves, are they healthy enough to manage the PHCs? Because unfortunately, we have an instance where state government have muzzled local government administrations, that they don't even have the means. And when I say means, the resources, finance-wise, to be able to manage and respond to issues in their domain, even when those issues are within their statutory responsibilities. So, you know, primary health care, when you look at the Alma Mater Declaration of 1978, health was domiciled within the local government structure. And God bless his soul, this former hard-working Minister of Health, everybody knows him, Ransom Kuti.
Okay, yeah.
He strengthened PHC system in his time throughout the Babangida administration, that was the Minister of Health. He did quite well. But we have these 33,000, like you read out in the statistics. The issue is how many are functional? How many of them are functional? Because those are the ones that can easily attend for a greater proportion of our population, especially those who are socially excluded and vulnerable. There are people who don't even know what a PHC looks like, maybe because they're in the city center. I was involved in a project that we worked in, maternal and child health project, that we worked in about 1,200 primary health care issues. And we did a need assessment some years back. And it will interest you to find out that you go to these places, there are no medical officers. You go there, they don't have even maybe water. I mean, a water source. I know you can't function
which is the most basic
fundamental thing that they need to clean up. You need to make sure that
maybe even water more important than the building itself.
There are infections, nosocomials.
Yes.
Infections that we get. You need water to be able to clean up the place, make it aseptic so that people can, but they don't have water. And that project tried to provide boreholes, water sources. It was following the need assessment that we discovered that these PHCs don't have these things. They don't have the full complement of human resource that is needed to service a PHC. Some of them don't have an OIC, an officer in charge who must be a midwife. They don't have the CHUs. They don't have, and so the medical officer may be in name. They have somebody, but that person comes once in a month from the state capital, who is monitoring to make sure that the person is there. And so, and the primary health care center is not functional because of these anomalies. And we need to strengthen the primary health care center. If you look at the basic health care provision fund, there are some objectives in that fund. And I'd like to tell you one of them. Let me tell you one, in fact, number one, it says to achieve at least one fully functional public or private primary health care facility in each political ward. I'm quoting exactly from the 2014 National Health Act. In each political ward, and at least 30% across all ward in the next 3 years, 70% in the next 5 years, and 100% within 10 years.
Wow.
This was supposed to have started counting in 2015. Have we achieved this? Do we have fully functional primary health care centers in each political ward? And we are looking at the next crop of leaders that will emerge in the next few
days, yes.
couple of weeks. Are we making these demands of them? That in your ward, we have fully functional in the sense that you can access the basic minimum package of health service. Basic minimum. We're not asking for extra. This one is not extracurricular activity. We're asking for the basic minimum package of health. That is what makes it functional. Does it have the complement, the requisite staff? Do they have the vaccines? Do they have the commodities? Do they have the drugs? What's their supply chain like? We need to start making those demands.
Yes.
Health charter. Somebody said, I remember one of the former commissioners of health in Ogun State, in one meeting, one summit that we had in Abuja, he said, it is time for us to transcend from health advocacy to health activism. He said, it is time we transcended, high time we transcended from health advocacy to health activism. The irreducible minimums, the covenant, the charter will be entering with those who are going to occupy positions of authority. The commissioners of health in the state, what are they doing? When they come to the National Council of Health meeting, are they raising these issues? Are they asking questions? Where is the money going? This appropriation, the 1 trillion budget in the 2023 fiscal allocation to health, out of the 20.5 that we have for our fiscal year, this 2023, how many that is going to this component of health? Who is tracking it to know whether it's been expended? When it is read out in paper, who is tracking it to show whether it has been released? Because budget maybe appropriation is different from budget release. It's possible you look at the numbers, but it's not yet released. Who is tracking? Citizens should be demanding this. That is what leadership is all about.
Yes.
Responsibility. It is not a tea party. It's not for someone to get up there and just be there occupying and taking the perks and the privileges of the office and not. In the local government system, we have supervisors of health. We have the monitoring and evaluation officers for health, for various disease component areas, various thematic areas. Who is following them up? Citizens should be making demands, charters, and asking questions.
Now, this is the role of the citizens on what to do. Because it's not a privilege.
The office of the citizen is the highest most exalted office in any nation. But unfortunately, maybe when you become a middle class person, you feel you're good to go. You can afford to get distance, and you relinquish your duty, the duty of that office as a citizen. You know, our leaders take us for a ride in this part of the world, Nigeria, Africa, inclusive, many nations, because the citizens are not up to their responsibilities. They come around every 4 years, throw something at you, and then they get into party for the next 4 years. We have a role as citizens. And this is the time for us to make those bargains and negotiations. Why would you be asking me for your vote if you are not willing to provide for my health? Why would you be asking me for my vote if a greater percentage of our children are out of school? Our mothers are dying. People cannot access, you know, when you look at the SDG, the Sustainable Development Goals, I talked earlier about those that have to bear with it. Look at Goal 2 that talks about ending hunger. When people don't feed well, when people are not eating balanced meal, it has a bearing on their health. Are you asking the leaders the questions? Why can't we get into agriculture, optimize it so that there's a good enough food? Look at the land, the arable land of Nigeria, by the mercies of God, because I'm into field work, because I'm involved in everyday health research. Under God, I've moved around these nations, from the north to the south. You travel. When you move around on road, doing field supervision and monitoring, you see the arable land everywhere, just lying fallow. We need to be asking leaders, what are we doing with these resources? What are we doing with these resources, the land that we have, to generate food so that our people will eat and be healthy? That is health.
I think the citizens should also take a bulk of the blame as well.
We are those guys.
We actually, yes,
we
should take a bulk of the. Somebody cannot come and dance and promise you carelessly.
Sometimes our campaigns are even empty. They just come and talk
yes.
through tantrums.
Now we're talking about a debate.
And then we are not discussing
I remember American election. Of course, those guys, their democracy have come a long way. But I mean, we don't have to go through the same path they took. We can learn from where they are.
That's why theirs have gone a long way.
Yeah, a long way for us to learn, a model to learn.
And not make their mistakes.
Not make the mistake. But we should have health sector debates. We are sitting down and demanding, not just the president, not just the governors, the local government. We should sit down and ask them, what are you going to do? What have you done? In fact, some of them don't even know what is happening.
Do you know at the primary health care level, every primary health care, they have this cluster approach in its management. Every primary health care should have a ward development committee or ward committee on health. One of my good friends, I think he's been here in the past, Dr. Laz.
Yeah, there's
a recent book he wrote, How to Make Our Hospitals Work. He looked at issues around primary health care also. Now, the Ward Development Committee or the Ward Health Committees should sit statutorily, routinely, to look at the issues that are coming out of the facility within their jurisdiction. Who is the leader? Who is the chairman of that committee? Are they doing it? Are citizens seeing them meet? Because they are supposed to ensure that everything is good enough for the primary health care center to function in their immediate domain. The National Primary Healthcare Development Agency, working with the State Primary Healthcare Development, have these things provided for in their frameworks. This is their statutory mandate. But if you ask several of us in the city, who perhaps may be members of that committee, when was the last time they sat? We may not know. And so we are not accountable. There is no accountability in the system. And these are the things that draw strength out of the system, that at the end of the day, when you begin to look at the reasons why we are not a healthy nation, these are the reasons.
These are the reasons, yes.
You don't take them in isolation.
Because
health is a systemic thing. It's a system. It's a system. And when you look at the pillars of every health system, there is the governance there. There is the health financing component. There is the HRH, human resource for health.
Yeah.
There is the health information system as well, your vital statistics. Who is getting the numbers? The numbers that will inform for policy, are they research driven, or do we just plan without numbers? These are the components of an effective. What about the essential drugs? These are components. Do we have them? At the global level, Bill and Melinda Gates Foundation, some of these IPs, international organizations, are bringing in money to secure drugs, vaccines. Who is tracking? Are they getting to the hinterlands? Why should Nigerians still be dying of vaccine-preventable diseases? Why should any woman die of complications of pregnancy? Why should we be having things like eclampsia, pre-eclampsia, cleaner women? Why should we, in 21st century Nigeria, we do the NDHA survey, and it will surprise you to know that the rate is 128 per 100,000 live births. In a country as rich as Nigeria, then 570 for maternal and child mortality is unacceptable. we need to be making these demands. And like I said, nobody is going to reinvent the wheel. These things are already laid out.
There, yes.
Let's just do our work and implement what is there. All of us will become the better for it. All of us will become the better. Imagine the effect on our GDP as a nation when all of us are healthy. You will have a thriving economy. Everybody is contributing his or her quota to the building of this economy. Health cuts across all facets of our life.
But there's something
so we need to become more responsible
citizens. Exactly.
More responsible citizens in our various...
Just to add to what is happening now, because I've seen lots of young people have woken up to voting the leaders, you know, say we don't want this, who we want. It's not just the voting. After voting, the young people as well should sit down and monitor and ask questions.
Exactly.
The areas we need to, it's not just to be asking questions blindly. The areas you can get involved in it. Because it's a whole, you know, there's a lot required to achieve the governance, yes.
I think partly we started on a good premise by talking about the need for us to have a PVC.
Yes.
And INEC has said we've seen an upsurge of young people registering in this election that is coming on. It's an election like no other. We've seen interest of young people. You know, young people used to stay aloof.
Yes.
I remember back in the days, on the day of election, you see them on the street playing football. But I think what has happened to us as a nation in the recent past has taught some of us that we need to pay close attention to leadership. I mean, John Maxwell said, leadership, everything rises and falls on leadership. You know, sometimes we don't know that the quality of your life is directly proportional to the quality of leaders you have where you live.
Exactly.
The heaven, the scripture tells us, is God's, but the earth is given to the sons of men. So when you outsource that to lesser quality men who don't have any inkling of what to do with power, you become the worse off for it. So we need to become more responsible citizens. After voting, make sure that I won't tell anybody to go fight or to expose yourself to violence, but make sure that you defend your vote and then that the votes are counted. But when people are sworn into office, the business has not ended. You still need to hold them accountable. They should have it's not when they are campaigning that they should only be having town halls. They should have routine, periodic town halls to give us their scorecard of what they are doing based on the different promises they made in the different development thematic areas. When it came to agriculture, when it came to health, when it came to education, these are the things I've done. Leaders should be able to tell us this in their town halls. We mustn't wait till the next cycle of election for them to start engaging us via town halls. So citizens should be up to their duty, be making demand. And you can't make demand effectively when you are not informed. Information is power. We have a lot of young people who don't open up the books, who don't read, who don't even know what is happening in terms of governance. They can afford to waste their time. And let me also be careful in using that wastage in a very restricted sense. They can afford to waste their time on social media. They can watch all the reality shows, but they don't want to spend time knowing this is the money that is supposed to come for my health in this community. Let me make a demand of my health supervisor at the local government level. You know, I've been in meetings that when the person at the other side of the table realize that you're arguing from a position of strength, that you have the information, that person will be careful in his or her response. But because many young people in our time are not interested in being informed in doing these things, they just go there. Somebody bamboozles you, throws the money around, you just dance and go.
And then you go,
And then the next 4 years, nothing is happening. You don't know that death could have been prevented if we have systems that are working health-wise. So this election, which, like I said, is election like no other, will not end with your voting. You need to continuously hold leaders accountable. The irreducible minimum. There is the basic minimum package of health service. Who should be providing health? Whose obligation it is? What do you expect from your health officer? In fact, one of the drawbacks we have in the health system sometimes is the attitude of healthcare providers themselves. But some of these conventions and frameworks has provided that your health officer should at least treat you with respect and decorum.
And that's the area I was coming to, the health givers as well, because there are also
Healthcare
so many
providers,
healthcare providers. There's so much, also a lot, impeding their own progress as well, because some of them claim that they're underpaid. They're attending
And
to a lot of
trainings that are supposed
to go. They
refresh
can,
us,
yes,
to build their
refreshers,
capacity.
yes.
They've been on a position for 10 years.
10 years and they've not done anything yet.
Yeah.
Like my other guest talked about how you go to other countries and you see people who both of you are supposed to be and what they know you don't even
don't know
I mean,
it.
other countries are already using robots to do surgery.
Or somebody you perhaps graduated with from medical college. And then he travels out of the country. And next time you are seeing it, he's already attended these capacity building trainings, built himself up. And these things were state-driven, state-sponsored over there.
Yes.
And then you are still at that level he left you. I mean,
he only wants to attend to you. When you're coming, he's in a hurry.
You are not on the same.
I mean,
you're not flowing on the same.
Some days ago, my dad went for, he went to a general hospital for a medical check, and he wasn't happy because he wasn't giving that much attention. And then recently he went for another one, and the doctor who's older took his time. In fact, they spent 3 hours. He had to go through his history.
And this, geriatrics now, managing old people's health is also a specialized area that people need to know how to manage it. The way they treat old people outside the shores of this nation. Once you're 65,
it's different.
You enter a bus. You don't pay for it. You don't get tickets. And when you get into the hospital, in the UX, for example, you see every old person telling you every other day, I have a doctor's appointment. The veterans, they everywhere have a doctor's appointment. And they go there, you see them, chat them up.
Yes.
Beyond giving them the drug.
Yes.
One of the things you have to know about managing old people is also they feel nobody have time for us. When they get to that stage of their life.
Yes.
So when they get to this appointment, those who are professionally trained will engage them, chat them up for the next 45 minutes, 1 hour. They live with a whole lot of relief.
My dad came back and told me, finally I've gone to the hospital. He said, finally I've seen it.
Because he met an older person
who had the time.
These are what training can do.
Yes.
Building the capacity of these young people who are coming up, telling them, this is how you manage an older person. Because by spending time discussing issues, chatting the person up, you've added life
to the person, yes.
So, but some of them have been in that and they don't know that. They don't know any jack.
Yes, training and retraining is very
training
important.
is important. Healthcare personnel, training, retraining, ongoing capacity development.
Yeah.
There's something they do. Is it continuous education? Sometimes when you want to get licensed, they will ask you how many courses you've attended in the course of the year to continuously develop yourself.
Yes.
Unfortunately, in our system, sometimes people beat the system. They may not have attended those things, but they pay the money and they get their license renewed for the year.
So also, the young people can speak up for our medical professionals too. You can speak while you're holding your leaders responsible. Also speak up for other persons who are in the medical profession, because some of them are even dying from ailments as a result of.
Look at even the gains of the marginal reforms we saw, even in the police service.
Yes.
Following the NSAS
protest,
because some of them protested and said, police should have better welfare packages to do their work. I mean, the temptation you see facing them every day perhaps is because they are not well remunerated. So people should also advocate for the doctors.
Okay.
Imagine a doctor who has 8 patients, 20 patients to attend to in a day. He also
has family issues.
He has
bills to pay. Yes, rent to pay.
He has fuel to procure. In this biting fuel condition that we all witnesses to, he's also a human being.
Wow, we spoke a lot today.
So those are the issues. They need people to speak up for them. When they have the National Health Council, the commissioners of health, in that meeting, if you go to some other climes, healthcare providers are among the best.
Yes.
In terms of what they receive.
What they receive, yes.
I've seen people who left this country, perhaps as professionals, as lawyers, and they are nurses in the US today.
And they're doing very well.
And they're doing well. What is the incentive that is moving a lawyer to leave legal practice and become a nurse in the US or in Canada? It's because you know that they will get well paid, and you can convert maybe those dollars, and then you can see what you're able to do
with it,
over time in this part of the world. What is there? What is moving them? It's the incentive. They are well paid. And so when you're working and you know that at the end of the day I've got something to show for it, you'll be motivated to work. They should be exposed to trainings. Their capacity continuously should be built.
Yeah.
Why would we have politicians who earn the highest pay in the world, and then our professors and
professors are
doctors
not
struggling in Nigeria?
earning so much.
The conditions of service are not encouraging, I must say. So we need to up our game.
Thank you.
And for those also who are relatively better paid than others, they should also have a justification for it. We shouldn't encourage this attitude of them building their own private institutions at the expense of the public institutions. We also, it's a two-way thing. You need to balance it. We are not against you establishing your own private practice, but at the same time, justify the pay if you are getting pay in a public. How do you justify it? Make out times and be there. When it's time for you to be consulted, when it's time for you to be consulted, you should be on seat. And not that you are not there, and then the residents are attending to you on your behalf, and then you are doing your own private practice.
Thank you so much.
Who comes to equity
must come with clean hands. Thank you so much. Thank you so much.
much.
There's a whole lot to talk about because I know the passion that's always involved in talking and discussing health. Now, one of the things I'll take away today is, and I want everybody to take away with, is health is a right. It's not a privilege. Your health is a right. You must demand it.
Even God is interested.
He's interested in
I wish above all things that thou mayest prosper and be in health,
even as your soul prospers.
So God is interested
in health. So health is not a privilege; it is your right. So you must ask it of your leaders. And on that note, we'll end today's program. Thank you so much for joining us. My guest for the past 15 minutes or so has been Chukwuebuka Ejekam. He's a public health expert. And he's also the Bible study presenter. Thank you for joining us on the program today. We'll see you next time. I'm Angela Emeka Ivibo.
Thanks for
Goodbye.
the good works.
Bye. Thank you.
God bless you.